At Planned Parenthood, we believe everyone should have the right to make their own healthcare decisions. You are the best person to decide what's best for your family, your body, and your future. If you're pregnant, you have 3 options: abortion, adoption, and parenting. Whatever you decide, Planned Parenthood is here to help. If you decide to have an abortion, there are 2 safe and effective ways to do so. An abortion procedure, or abortion pills, also known as medication abortion. What are abortion pills and how do I take them? Commonly called the abortion pill or medication abortion, it is either a combination of 2 different medicines, mifepristone and misoprostol, or just misoprostol alone. In this video, we'll focus on the 2 medicine combinations. First, you'll take mifepristone. It stops the pregnancy from growing by blocking a hormone called progesterone. Then, either right away or up to 2 days later, you take the second medicine, misoprostol. Your healthcare provider or Planned Parenthood staff will give you specific instructions about how and when you should take yours. The pills will cause cramping and bleeding. This is normal. It means the medicines are doing their job and your uterus is emptying. Using mifepristone and misoprostol together have proven to work very well. It's up to 98% effective when taken before 8 weeks, about 96% effective from 8 to 9 weeks, and about 92% from 9 to 10 weeks. It's up to 87% effective from 10 to 11 weeks. With an extra dose of misoprostol, after 9 weeks, it's up to 99% effective. What are the benefits of the abortion pill? Some people prefer the abortion pill process because it can feel less invasive. It's a safe and effective way to end a pregnancy. Of course, as with any medicine, there are risks. Risks of the abortion pill are rare. The pills may not work to end the pregnancy. That's why it's important to follow up to make sure the abortion was successfully completed. When the pills don't work, your doctor or nurse may have you take the medicine again or go into a health center for an on-site procedure. Rarely, blood clots in the uterus can build up and cause intense cramping and belly pain. If this happens, you may need to go to a health center for an on-site procedure. An incomplete abortion means your uterus didn't completely empty the pregnancy. This may lead to heavy bleeding, infection, or both. If you bleed too much or too long, you may need treatment with medicine, an on-site procedure, or a blood transfusion. You could also get an infection in your uterus. Usually this can be treated with medicine, but there's a small chance that you may need an on-site procedure, or you may need surgery to treat it. You may have an allergic reaction to the medicine. If any of these things happen, you should contact a doctor or nurse right away. While extremely rare, as with any medical procedure, there is a risk of death. The risk is much lower than the risk from childbirth and from things like allergic reactions to medicines like penicillin and acetaminophen. What else do I need to know? After you have taken the abortion pills, it's important to make sure the abortion was successful. You can do this by taking an over-the-counter pregnancy test, having an ultrasound, or having some blood drawn. It can take up to 5 weeks after taking the pills for a negative pregnancy test, so it's important to wait until then to take one. It's important to be sure about your decision to have an abortion. Misoprostol can cause serious birth defects if the pregnancy continues. It's common to feel lots of different emotions after an abortion. The most common feeling people report after having an abortion is relief. If your moods worry you or keep you from doing the things you usually do, call your nearest Planned Parenthood Health Center. They can help and provide resources. If you have any questions or concerns, please call your nearest Planned Parenthood Health Center. We're here to help, and your health and well-being is our highest priority.